Well, hello everyone. My name is Allen Huang. I'm a physical medicine and rehab physician. I'm part of Casa Colina's spine care clinic. Today I'm going to talk to you a little bit about some of the basics of spine care. So just to touch on my background a little bit. So my specialty is physical medicine and rehabilitation. Just briefly, it's just a combination of two areas of study of interest. Physical medicine, which is focusing on more the treatment of primarily disability and pain with certain modalities such as heat or exercise or electricity. Now the second part is the rehabilitation part, which is more focused on improving someone's function, improving their independence and quality of life. And so those two areas of interest have sort of combined into my specialty. Now the area of, or the specialty of PM&R has changed over time, and now it's evolved as new technology and new information has come about. So much of it is related to interaction with other specialists like physical therapists and acupuncturists and psychologists. We employ a holistic and multifaceted approach. We tend to use, again, a lot of new technologies that are available, new devices, medications, to help us in terms of diagnosis and treatment of various conditions like muscle pain or back pain, and various other conditions like stroke or brain injury. So just to touch on the spine and the anatomy that we're talking about today, we're just going to highlight sort of some of the major areas. So we have the cervical region, sort of your upper neck, your thoracic region, and your lumbar spine. And those are the areas we're primarily focusing on in general. As you can see over the side here, you have your a cross section of the vertebral bodies, and you can see that they change with each level as the function of the bony parts changes. So this is just a diagram of some of the nerves as they come from the brain and go down to the spinal cord, and they exit at each level of the spine itself. So we have the cervical level with C1 through C8. You have your thoracic level T1 to T12, and then your lumbar from L1 to L5, and also your sacral roots. Typically, we were more concerned with S1. But this is just a brief diagram of how these nerve roots are traveling throughout your body and out into your limbs. So onto the side here, this is a diagram of the dermatomes of your body. So, and they're kind of labeled. So typically, at each level, what we call dermatomes, which is a patch of skin, is affected by a certain spinal level. So we have examples here, like your thoracic level is kind of in a lighter color, and your cervical is a little bit darker. C2 through C8, and T1 is actually part of the arm as well. And then in blue, we have the lumbar and sacral levels innervating those patches of skin in your leg. This mini little table on the bottom sort of describes some of the basic movements of the body and sort of the general nerve roots that control those functions. Now, it's not quite that simple, unfortunately. Elbow flexors are actually more a combination C5, C6 as an example, but it gives you a general idea of what my nerve roots how it affects your function of your body, or what actions you may perform. So just going into more detail on the levels of your spine. Cervical spine main function is to support the weight of your head and to provide for a range of motion. So turning, nodding, so allows you to turn, communicate with people, look without needing to turn your whole body, those kind of things. Thoracic spine, main goal is to really protect the major organs of your body, of your torso, and to help support the rib cage as well. Lumbar spine is, as we saw from earlier slides, it tends to be a little bit heavier. The bones are a little bit heavier to help bear the weight of the body, basically the upper body. sacral region and the coccyx we often combine together as part of the pelvis. And they help to sort of connect the main part of the spine with your hips and your lower body. So this is kind of just a side view of your spinal cord, including your brain as well. So one thing to think about is how the spinal cord is more on the back part of your body. And so it's important for them. Next slide, I think I have a teeter-totter. So what's important is that actually what's often an issue with the weight of the body, the center of gravity is actually in front of your spinal cord. And so to keep you upright, these muscles in the back are often have to work very hard to keep you upright. And so this is often why we have low back pain. It's often a very common source of pain. And this is just a diagram of all the muscles. Then certainly there's even more than this, but this just kind of shows you the complexity of the body. So just to touch on some common pain generators. So we have here's a cross section of the spine. This is a intervertebral disc with a herniation. So, and this is your spinal cord next to your disc. So this diagram actually shows a number of possible pain generators. So one is this disc herniation pushing or pressing on a nerve as it's exiting the spine. Here we have a thickened ligamentum flavum, which may also cause some compression of the spinal cord itself, which sometimes causes pain or may cause numbness or tingling or weakness in your arms or legs or your torso. This is kind of another diagram of another cross section of your vertebral body. Now on the right here we have sort of diagrams of how weight puts force on your disc. So this is kind of this is a diagram of the disc, intervertebral disc, which is kind of the cushioning part between the bony parts of the spine. And so here we have a little arrow pushing down, and it leads to force that goes out to the sides, and then these discs will tend to bulge out a little bit, and you have here a cross section where you see those forces kind of pushing out on the disc. Now this, I think lower down, this sort of shows that there's maybe a little more force, and with force over a long period, this may lead to actually a herniation of material out of the disc into the spinal canal. Another common source of pain is actually the facet joints. So every vertebral body has a way to interface with the one below or above and below. So this is actually a true joint, and this can often be a source of pain as well. These are structures that probably Dr. Martinez and Dr. Giovanni will be discussing a little bit more in detail with their talks later on in our series. So this is just a list of not all the treatments, but some of the treatments that we may employ to help with spine pain in general. So weight loss, nutrition, ergonomic training or postural training is actually really key in general to help reduce pain, but also to decrease pain in the future. And we have a few questions that one of them will sort of touch on that issue. We can talk about ergonomics and how to lift properly, like we talked about using your knees to lift and to protect your back, stretching to make sure your muscles are functioning properly, so there's no muscle imbalance or tightness, which may pull your body into more abnormal positions or lead to muscle imbalance, which may cause pain on its own. We've all heard about core strengthening. It's very popular with a lot of exercises nowadays, like Pilates or yoga, in terms of strengthening your core muscles that help support your spine. And then TENS is a modality to help with electrical stimulation to your skin and your muscles to help with reducing some of that pain. And aquatic therapy or aquatic exercises are a way just to exercise, help with weight loss, help with your cardiovascular health while still not putting too much strain on your joints. And of course, there's other medications and other possible treatments like trigger points, which are trigger points are basically muscles or areas of muscle that are spazzing very tightly, and when you press on it, it radiates pain to other locations. So sometimes putting a needle like an acupuncture needle may actually relieve some of that pain. So one of the big problems with spine pain or back pain is that there are many potential causes, and it's sometimes hard for any person to really figure out what the cause is or what we can do to fix that. It's a very common problem for adults. There are lots, like we sort of went through in the earlier slides, there's lots of potential causes for that pain. So it's often difficult to figure out what's the best treatment, what is the reason for this kind of pain. So oftentimes we do need a multidisciplinary kind of approach to make sure we get the right answer, we get the right treatments. Okay, I think we're at the end here. Yeah, I think we're ready for questions, I think.
Okay, so our first question that we have is, I have had back and leg pain for 6 weeks. My primary care doctor says I have a herniated disc. Do I risk permanent damage if I don't have the surgery?
So that's a very common question. Partly it depends on how bad the irritation is and whether it is actually a herniated disc. Oftentimes radiating pain may be from a disc herniation causing impingement or irritation of a nerve root, but it could be other causes as well. In terms of causing permanent damage, it's hard to say without maybe taking a closer look. So that's often why having a physician or having a physical therapist work with you to see how bad that irritation may be. Certainly if there's signs of like really significant damage, like weakness, or there's bowel bladder problems, that may be a reason for surgery more urgently. But typically with conservative treatment, our goal is to try to relieve your symptoms, give your body some time to heal. If it is a disc herniation, give your body some time to scar down so it doesn't cause that irritation. But it's sometimes hard to answer that question without seeing the patient, but the best thing to do is actually maybe see an expert to figure out what the next step, what the most appropriate step is. So basically my answer is kind of depends, like what's going on. So.
Okay, our next question. I have had back pain that comes and goes. It has been bad for the past 3 months. I'm not a fan of pills and I don't want surgery. Are there any other options?
Okay, so in my earlier slides, we touched on a number of possible treatments. Typically, the first thing we do recommend is physical therapy. In terms of relieving your pain, there's multiple techniques they can employ, like myofascial release. They can actually work out the muscle. Helping you to figure out what the pain is coming from is actually really key. And having a physician to work with you and figure out what the pain is coming from is also very key. Once we can make a proper diagnosis, we can move on to treatments, which don't necessarily involve medication. There are, again, physical therapy, there's acupuncture, there's trigger point injections we talked about. There are pain psychologists who can help with relaxation techniques, which may also help with dealing with pain. So there are certainly a number of options besides just surgery, or even interventional pain management, which Dr. Martinez will touch on later on. So in terms of epidurals or facet joint injections, we can talk about even, we can talk about like the other devices. We can try TENS we touched on before, where you can apply electrical impulse to see if that may help reduce pain. So there's a lot of options. Again, that it's hard to navigate all the potential options on your own. So that's why having someone to help you work through it, I think, is really key to figure out what the best treatment is.
Next question comes in with, I recently hurt my back lifting. What determines whether I should get a test on my back, like an X-ray or an MRI?
Okay, so this is probably a common theme where I feel like making a proper diagnosis is really key. So that sometimes requires expert help. And so oftentimes it depends on the severity of symptoms. If you have, again, loss of bowel bladder function where you're incontinent, you can't fill when you have to go, or you can't empty your bladder, or your legs stop working. Those are examples where you need to be seen urgently, that you should go to the ER. And that's when you need imaging like a CT or MRI right away. Now, if you have just pain that's maybe more intermittent, or it's not so severe, or you don't have any other what we call more neurological symptoms like radiating pain or like weakness or numbness or tingling, then you can maybe work on maybe you can just use or employ more conservative measures. Now, X-rays are a useful tool. They're inexpensive. You can get a lot of information from them. They do involve using some radiation, but it's pretty minimal. A lot of it, when we use X-rays, it's largely dependent on other risk factors, like was there trauma? Did you fall? Is there a suspicion you may have a fracture? Are you having fevers or more pain at nighttime? Is there a suspicion you may have like a cancer or metastasis in your back? That may be a reason to do X-rays. So what kind of testing you should do, I think it's hard to determine yourself. I think that's where again, experts can help you, like people at Casa Colina, to help figure out what the next step is.
Okay, we have a question that came in that says, I had a tear at L5-S1 level. I also have osteopenia. How often should I be doing a bone density test? Okay, those are maybe a little bit independent questions. A tear at L5-S1, that could mean like a disc herniation or an annular tear. Again, a lot of it depends on what your symptoms are. Are you having pain just in the middle of your back? Is it enough that it's causing pressure on the cord, on your spinal cord, or you're causing weakness or numbness? Osteopenia, that's basically thinning of your bones. That's probably a question that your most primary care physicians can work with and figure out how often you should have a DEXA scan. And it depends probably on how the osteopenia was diagnosed. Typically, every few years may be reasonable to track your bone health and your bone density. And again, it depends on other risk factors, like if you're taking steroids, your age, gender. Those are possible contributing factors to how often you may need DEXA scan. Other possible treatment or other things to consider is whether you should be taking calcium or vitamin D. Those are things that a primary care doctor can help you with. Next question, can chronic back pain be cured or just managed?
So just from the nature of the question, I guess, if it's chronic pain, it's often a chronic recurrent issue where you can hopefully control it or improve it and possibly cure it, but our expectation, or oftentimes these kind of pains do recur and they happen again. So management is probably the most important thing to focus on. So that includes reducing the pain if it happens acutely, but also to focus on your back health and posture training and exercises to keep your core strength up. That's really key for all of us in terms of back health, to help prevent pain. Especially nowadays when we're working in offices all the time, we're working on computers. We have bad posture. We don't have the chance to exercise as much. I think we're ready for the next question, actually. Yeah.
The next question, I have pain running down my leg. My doctor said it is coming from my back. What would be the first step for me if I came to Casa Colina?
So the main process is you can call the number and we can set you up an appointment with one of our physicians, typically myself or Dr. Sangnell. And so the first thing to figure out is what the pain is, or what it's coming from and how urgent it is. And So part of that evaluation, we might order X-rays, we might order therapy, we might, if it's significant enough, we may jump to an MRI. We may even refer to our colleagues, Dr. Martinez or Dr. Giovanni, depending on the nature of the symptoms. The first step is really just to provide help and provide the guidance to get to the next step, basically.
One more question that just came in. If I do need surgery for my back, can I do that at Casa Colina?
Oh, absolutely, yeah. We have a number of surgeons that work here, not just our spine surgeons, but orthopedics as well. So we have quite a number of surgeries that happen at Casa Colina. So that's absolutely can be done here.
Okay, that is all the questions that came in for this evening. Dr. Huang, thank you very much. We invite everybody to join us next Thursday, March 11th at 6 p.m., where Dr. Carlos Martinez will be doing the second part of our webinar series. Thank you.